and body of sternum. Type: secondary cartilaginous symphysis. Features: slight movement during respiration, important landmark at sternal angle, angle of Lewis. Clinical note: used to identify rib 2 and intercostal spaces. 2. Costovertebral joints. Location: between head of rib and bodies of 2 adjacent vertebrae plus intervertebral disc. Type: synovial plane. Ligaments: radiate ligament, fans out from rib head, intra-articular ligament, rib head to disc. Function: allows gliding movements during breathing. 3. Costotransverse joints. Location: between tubercle of rib and transverse process of vertebra, same level. Type: synovial plane. Ligaments: costotransverse ligament, neck of rib right pointing arrow transverse process. Lateral costotransverse ligament, tubercle right pointing arrow tip of transverse process. Superior costotransverse ligament, neck of rib right pointing arrow transverse process above. Function: rotation and gliding of ribs. 4. Costochondral joints. Location: between rib and costal cartilage. Type: primary cartilaginous, synchondrosis. Function: no movement, firm attachment. 5. Chondrosternal, sternocostal, joints. Location: between costal cartilages and sternum. Type: first, primary cartilaginous. Second, seventh, synovial plane. Function: allow elevation, depression of ribs. Clinical note: can be inflamed in costochondritis. 6. Interchondral joints. Location: between costal cartilages of ribs 6 to 9, sometimes 9 to 10. Type: synovial plane. Function: flexibility of anterior thoracic cage. Bone vertebral column joints. 1. Intervertebral joints. Location: between vertebral bodies. Type: secondary cartilaginous, symphysis. Structure: intervertebral disc, nucleus pulposus, gel-like, shock absorber. Annulus fibrosus, fibrous rings, resist tension. Function: weight-bearing, flexibility. Clinical note: herniation of nucleus pulposus right pointing arrow nerve compression. 2. Facet, zygapophyseal, joints. Location: between superior and inferior articular processes. Type: synovial plane. Function: guide and limit movement depending on region, cervical, flexion, extension, rotation. Thoracic, rotation, lumbar, flexion, extension. Not ligaments of vertebral column. Continuous ligaments. Anterior longitudinal ligament, all, runs along anterior vertebral bodies, prevents hyperextension. Posterior longitudinal ligament, PLL, runs along posterior vertebral bodies inside canal, prevents hyperflexion, supports discs. Supraspinous ligament, connects spinous tips, limits flexion. Ligamentum nuchae, cervical extension of supraspinous, provides muscle attachment. Discontinuous ligaments. Ligamentum flavum, elastic, connects laminae, aids recoil after flexion. Interspinous ligament, between spinous processes, limits flexion. Intertransverse ligament, between transverse processes, limits lateral flexion. Anti-clockwise arrows movements of vertebral column 1. Flexion, bending forward, greatest in cervical and lumbar regions. Limited in thoracic due to rib cage. 2. Extension, bending backward, greatest in cervical and lumbar. Limited in thoracic. 3. Lateral flexion, side bending, greatest in cervical and lumbar. 4. Rotation, twisting, greatest in thoracic, due to orientation of facets. Moderate in cervical, minimal in lumbar. Wind face thoracic cage movements in respiration. Pump handle movement. Upper ribs, 2 to 6. Sternum moves forward and upward right pointing arrow increases anteroposterior diameter. Bucket handle movement. Lower ribs, 7 to 10. Ribs move upward and outward right pointing arrow increases transverse diameter. Caliper movement. Ribs 11 to 12. Move laterally like calipers.